Hi, everyone. Welcome to this month's case study. It's all about a woman in her late 20s who's struggling with uterine fibroids. So we're going to look at her Dutch cycle mapping and her Dutch complete results and try to understand how we can use those results to come up with an example treatment plan. So it's really interesting. We're going to see that the way she's metabolizing her estrogens could actually be contributing to her fibroid growth. So let's dive in. Let's do this. This is me. My name is Dr. Kelly Roof. I am a clinical consultant for Precision Analytical. And this is my Instagram, Dr. Kelly Roof, if you want to find me online. But probably better to email info@dutchtest.com because I'm kind of slow to respond on Instagram. Okay, here are the learning objectives. We're going to learn a little bit about uterine fibroids. This isn't meant to be this comprehensive overview of fibroids. It's more about, okay, let's learn a little bit about fibroids. What are fibroids? And then how does it relate to the Dutch test? And then we're going to look over our case study. All right, so uterine fibroids. Uterine fibroids can have different locations within the uterus. You'll see here that some of them are inside, interior, these submucosal fibroids. I've often heard that the submucosal fibroids can bleed the most, but I was looking into the research. I'm not so sure that's actually true. We have these intramural fibroids, so these are actually within the uterine wall. And then we have some fibroids that can be outside of the uterus. So just wanted you to know that fibroids can have different locations in and around the uterus. So signs and symptoms, it's really important to know that many women are asymptomatic. And if you look at the research, a lot of women get a fibroid during their lifetime. Like a lot of women have a fibroid somewhere during their lifetime. And a lot of people just don't even know that they have the fibroid. They're asymptomatic. But sometimes women are symptomatic and they can have heavy bleeding, they can have pelvic pain and pressure in the area, urinary frequency, back pain. It can affect bowel movements, can have constipation, and it's associated with anemia, infertility, and adverse pregnancy outcomes. So if you think about it, if you're bleeding a lot, like if your fibroid is bleeding, you can lose a lot of blood and that can make you anemic. Also, just if you think about the location of the fibroid, sometimes that can affect pregnancies and implantation. Okay, so here are some factors that increase your risk for a fibroid. The number one, first one here is age. As you get older, your risk for fibroids goes up. Race, Black women tend to be at a higher risk than white women. Early menarche, so if you get your period for the first time when you're under 10 years old, you have an increased risk for fibroids. And starting OCPs at an early age. This was actually from one study, and they found that women who started OCPs or oral contraceptive pills between the ages of 13 and 16 had an increased risk for fibroids. Obesity, family history of uterine fibroids, high blood pressure, interesting, no history of pregnancy. So if you never get pregnant, your risk of fibroids goes up. Vitamin D deficiency, phthalates, PCBs, bisphenol A or BPA. So environmental toxins can definitely increase risk for fibroids. Prenatal exposure to DES, we don't really have that anymore, but in the past, that was definitely a concern. Beef and other red meats, ham, food additive consumption, and alcohol. So what about things that decrease your risk for fibroids? This is what we want to know. I'd want to know this so I can learn how I can decrease that risk. Pregnancies. So the more pregnancies you have, the less risk you have for a fibroid. Long-term use of oral or injectable contraceptives. I have a question mark here because it kind of seems like the research is mixed, but a recent study that came out last year in 2021 said that the OCPs decrease the risk for fibroids. Green vegetables. So you got to get your greens, your kale, your brassicas, all those green leafy veggies. Fruits, especially citrus fruit. I thought that was interesting. So, get your tangerines, get your oranges, get your lemons. If you make a smoothie, just add lemon to it every day. You know, it's delicious. It really kind of brings this freshness to the smoothie, and you'll get your citrus. Okay, here's the study here, and the takeaway was basically estrogen and progesterone can contribute to fibroid growth. So they've actually found that fibroids have more estrogen receptors than the surrounding tissue. Really interesting, right? So this is the paper I was talking about, the paper that was published last year. So they say OCPs with a low dose ethinyl estradiol. So remember, these combo oral contraceptive pills have synthetic estrogen in them, and it's an ethinyl estradiol. So the low dose, they were saying it was below, or it was 35 micrograms, I want to say, or lower, may lower the risk for fibroids. So that's a whole other conversation. In certain cases, I think oral contraceptives are necessary and can be great for women, but for the most part, I try to avoid them. But that's my opinion. That's a whole other topic. So here's another research study here. This one actually is an older one from 1998. And this is the one I was talking about that said women who started the OCPs at a young age, between 13 and 16, had that increased risk of developing fibroids. So fibroids are more common in Black women. This is a great study that talks about this. Also talks about how fibroids are more severe, like women tend to have more severe symptoms. So it brings us to this slide. Symptoms are more severe in Black women. So Black women tend to get fibroids starting at a younger age. They also tend to have larger fibroids and experience more severe symptoms. And they have an increased risk of hysterectomy compared to white women. So what does it say? 3-fold higher risk of hysterectomy compared to white women. Okay. So fibroids and vitamin D, this is a really interesting study that found that having sufficient vitamin D levels can reduce your risk of fibroids. So yet another reason to have your vitamin D within range, right? So Black women tend to have lower vitamin D levels because their darker skin can inhibit vitamin D production. So I think there was a few reasons that they were thinking Black women tend to have an increased risk for fibroids. And one of them was low vitamin D status. Another one was Black women tend to get their period for the first time. So they tend to go through menarche at an earlier age. And we know that can increase risk for fibroids. All right. So let's talk about our case study. This is Laura, and she's in her late 20s. She's struggling with heavy bleeding, tender breasts, and uterine fibroids. She's a white female. She's at ideal weight, so she's not overweight. Remember, obesity can increase risk for fibroids. And she's got regular cycles. They're between 26, 30 days. She's been diagnosed with PCOS, which is a little odd. When we look at her test results, we'll see that her androgens, like her testosterone, her DHEA, are not elevated. But she's been diagnosed with PCOS. Okay, we'll look at her cycle mapping results first. So this is her cycle mapping results. I don't know, maybe some of you have never seen a cycle mapping report before. So if you look at this, there's 4 graphs. The top 2 graphs are the estrogens. So on the left is estradiol, on the right is estrone. Remember, estradiol is our most potent estrogen. Estradiol is the one that acts on these estrogen receptors and can cause the tissue to proliferate in the endometrium. So it can kind of prep the endometrium every month for implantation in case the egg wants to implant. So we've got the progesterone metabolites on the bottom there, the beta pregnandiol on the left, and the alpha pregnandiol on the right. So let's zoom in on her estradiol, her most potent estrogen, because we know that these fibroids tend to have more estrogen receptors than the surrounding tissue. So estrogen levels can influence fibroids and fibroid growth. So this cycle that she tested was 30 days in length. And we can see here, so on the bottom of the report, we have like the measurement number 1 through 9. We've got 9 points on each graph. And then we have the days of the cycle it corresponds to, and then her result. And on the very bottom here, I have the ranges for estradiol. And I kind of cut and pasted, copy and pasted. So this is not exactly how the report looks, but I kind of copy and pasted to make it easier for us. So we can see during her follicular phase, that's the earlier part of the cycle, right? The first half. In the early follicular phase, that's when for cycling women, our estradiol should be at its lowest point. And our reference range is 1 to 2 nanograms per milligram. And hers came out to be 1.32 on cycle day 4. So that's within range. That looks good. Her ovulatory estradiol is also within range. So the ovulatory range is 4 to 12. On day 13, she's at 6.24, and at day 14, she's at 6.29. So she's within range. She looks good. And I will say most women, their ovulatory estrogen is around 6 to 8. That's just what I see when I look through thousands of these reports. Just what I see. So hers looks very normal to me. And we know that during ovulation, or in the ovulatory phase, we have that estradiol surge. And when estradiol surges, it has to surge to a certain point for a certain amount of hours. That will cause luteinizing hormone, or LH, to be released from the brain, right, from the pituitary. So LH will surge after estradiol surges. And with that surge in LH, it kind of signals the ovaries to release that egg. So when you have your estradiol surge, you usually ovulate within 24 hours. So I think she probably ovulated, if I had to guess, around day 14, 15, which would be pretty normal for a 30-day cycle. Her luteal estrogen, so the luteal phase is the second part of the cycle. It's the 2 weeks before you get your period. And the luteal phase is after ovulation. It's when after the egg is ovulated and that follicle becomes a corpus luteum, starts pumping out progesterone, right? And estrogen. Estrogen goes back up a little bit. And we think estrogen goes back up a little bit in the luteal phase to suppress FSH, right? Because that's follicle stimulating hormone. But also, it probably also helps to just support that endometrial lining for implantation. All right, so on day 21 of her luteal phase, or day 21 of her cycle, I should say, her estradiol was 2.72, which is within range. Our range is 1.8 to 4.5. But then day 24, she's at 1.23, which is below range, right? And she had a 30-day cycle, but her estrogen is just dropping off early. It's getting kind of low. So luteal estrogen, kind of normal, a little low. So if you look at her progesterone here, these are her progesterone metabolites. And I've kind of copied and pasted the data again so that we can look at it in a little more detail. And if we look at her mid-luteal phase, so the mid-luteal phase is in the middle of the luteal phase. That's when progesterone is at its highest, right? It's kind of when progesterone surges. And if we look at her alpha pregnandiol metabolite on cycle day 21, that's when her progesterone got to its highest point. Her alpha pregnandiol is 533. The reference range you can see below is 200 to 740. So within range, looks beautiful. The beta pregnandiol is 1,297. The reference range is 600 to 2,000. So within range, looks beautiful. So this progesterone looks beautiful. If she ovulated around day 14 or 15 and had a 30-day cycle, then she probably had 2 weeks, 15-day luteal phase, which is great. Usually the luteal phase is about 12 to 14 days. It's about two weeks on average for most women. It can be anywhere between 10 and 16 days. All right, let's look at her Dutch Complete results now. So this is page 1 of a Dutch Complete, and it's the summary page. So we kind of take some of the more important markers that providers like to see side by side, and we put it on the summary page. And if you've never read one of these dials before, just wanted to point out that for the estrogens and the progesterone, we have specific dials that have these 2 stars and also this little purple band. So in between the 2 stars, that's the luteal range. And this little purple band is the postmenopausal range. When you look at the androgens like testosterone or DHEA, in between the 2 stars, that's the overall range for all the ages. It's not the luteal range. Okay, just want to make sure we understand that. All right, so this is page 3 of a Dutch Complete. And we can see we've got progesterone on the top right-hand corner. We've got estrogen down below, and then the estrogen metabolites further down. On the left-hand side, we have the androgens. And if it's your first time seeing this, it could be overwhelming. Our test is very comprehensive, but that's why we have a lot of opportunities for clinical consults. So you can talk with one of us, myself included, to go over someone's test results and make sense of it. All right, so progesterone on the top right, progesterone metabolites, they're within range. Remember, in between the 2 stars is the luteal range. So this looks great. Her progesterone looks great. Her estrogen, so her E1 on the low side, her E2 is within range for this particular day, and her estriol is actually above range. And remember, when you do a Dutch cycle mapping and you pair it with a Dutch Plus or a Dutch Complete, what we do is we take all the progesterone and the estrogen data on the Dutch Complete or the Dutch Plus. So in this instance, all of this data, all the progesterone and estrogen data comes from the cycle mapping on the day that progesterone reached its highest point in the mid-luteal phase. So this came from cycle day 21, I think it was. So it's nice because we can see the balance between estrogen and progesterone right here. And her estrogen, I'd say, is kind of normal low overall. Her progesterone looks great though. But the interesting thing is the way she's metabolizing her estrogen. So the way she's metabolizing her estrogen can kind of make her body feel like there's more estrogen around. So let's dive into that. So if we look at these 3 metabolites, the 2-OHE1, the 4-OHE1, the 16-OHE1, these are all phase 1 metabolites, estrogen metabolites. And remember, all phase 1 metabolites are a little reactive. They can cause oxidative damage in the body. So we don't want them to be in phase 1 for too long. We want to move them over to phase 2, where they're more stable, they're more water soluble, they're ready for excretion, right? So how do you move them to phase 2? Well, good question. The 2-OH and the 4-OH, we methylate. We methylate them, move them to phase 2. The 16-OH, we actually glucuronidate and sulfate. So if we look here, her 16-OH dial is definitely high, right? This is definitely high. If you look at this pie chart on the right, and I kind of blew it up over here on the left of the screen. So this pie chart tells you the relative ratios of the phase 1 metabolites. So it can kind of give you an idea of, how much is she pushing her estrogen down each of these pathways. And she's obviously pushing her estrogens down the 16-OH pathway quite a bit. If you look at the little red pie slice here, so that is 4-OH. And 4-OH, that's the metabolite that we worry about becoming a semiquinone or a quinone and attaching to the DNA, becoming an addict and causing DNA damage. So the 4-OH is the one that we worry about for increasing risk for breast cancer. And her percentage is 11.1. Remember, we want to see it below 11% or 11% and below. So she's kind of a little tiny bit high. So if we look at the overall phase 1 metabolism, I'll give you kind of a summary. We want men and women to push most of their estrogen down. We call it the protective pathway, the 2-OH pathway. We want most of this pie chart to be green because green represents 2-OH. So we want, for percentage-wise, we want the 2-OH to be above 60%. She's only at 35.8. So, where is she pushing most of her estrogen? Yeah, down towards 16-OHE1. So the 4-OH, talked a little bit about that. That's the one that we worry about for breast cancer risk. The 16-OH, this one's so interesting because it's actually a proliferative estrogen. So think about the 16-OHE1 binding to estrogen receptors and causing tissue proliferation. So you can kind of imagine what types of signs and symptoms someone might have if their 16-OH is elevated, right? Heavy bleeding, right? All that tissue proliferation in the endometrium. Breast tenderness, all that tissue proliferation in the breast tissue. Even fibroids. Sometimes we see issues with fibroids. So we're going to want to assess that. Let's talk about 16-OHE1. So I said it's a proliferative estrogen. I didn't mention this though. Okay, it's more estrogenic than the 2-OH and the 4-OH estrogen catechol. So remember, those phase 1 estrogens can still bind to estrogen receptors and have estrogenic activity. But the 16-OH is more estrogenic than the 2-OH or the 4-OH, but it's definitely not nearly as potent as estradiol. That's good to know too. It can worsen estrogen excess symptoms like the heavy bleeding, tender breasts, and fibroid growth. So what leads to elevated 16-OHE1? Well, the phase 1 detox enzyme, the CYP3A4, it's responsible for the metabolism of E2 to E3. You can see that right here. Estradiol gets converted to estriol, mostly in the liver, by CYP3A4. And it also metabolizes E1 to 16-OHE1. So if someone is higher in both of these metabolites, if you look at the report and like this one, the 16-OHE1 is high and the estriol is high, then you start thinking, oh gosh, okay, CYP3A4 must be working overtime. It's upregulated. It's like full speed ahead. So things that can increase the CYP3A4 activity, we know this from the research. St. John's wort can increase it, caffeine, smoking, obesity, moderate alcohol consumption, PAHs, or the polycyclic aromatic hydrocarbons. So remember, I wrote about it over here, but the polycyclic aromatic hydrocarbons, they're produced when the gasoline, oil, coal, wood, garbage, tobacco are burned. So high temperature cooking, when you char foods, doesn't have to be meat, it can be veggies too. So if you're charring foods, grilling foods, those can cause polycyclic aromatic hydrocarbons. Even smoked foods, think about your smoked salmon and liquid smoke. If you ever get a cocktail and they add liquid smoke, probably has some polycyclic aromatic hydrocarbons in it. Say that 5 times fast. Polycyclic aromatic hydrocarbons. So yeah, those can increase CYP3A4 activity. They can increase the amount of 16-OHE1 in your body, the proliferative estrogen. Pesticides can also upregulate CYP3A4, and then certain medications, including glucocorticoids. All right, what inhibits 16-OHE1? Grapefruit. Actually, this should be CYP3A4 inhibitors, not really 16-OHE1 inhibitors, kind of. So grapefruit inhibits CYP3A4. And you might start thinking, oh, okay, but so many medication pamphlets say avoid grapefruit when you're taking this medication. And you know why? It's because so many medications actually get metabolized via CYP3A4. So if you're taking a medication that gets metabolized by this enzyme, this CYP3A4, and you're drinking a lot of grapefruit juice every morning, let's say it's like your favorite juice and you're drinking it every morning, it's actually going to slow that enzyme down. And whatever drug you're taking, whatever pharmaceutical you're taking, it's not going to be metabolized as quickly. It's going to kind of build up in your body and it's going to affect your body differently, right? So, okay, grapefruit, resveratrol, rosemary, wild yam, peppermint oil, azole, antifungals. So if it ends in azole, like ketoconazole, that can inhibit CYP3A4, and thyroid hormone, possibly. So note that the CYP3A4 enzyme is involved in the detoxification of many pharmaceutical drugs, toxins, and waste products. So we tell providers to inhibit this pathway at their own risk. Like you really wouldn't want to be taking a medication that is also metabolized by CYP3A4 and then add on a bunch of resveratrol and grapefruit and rosemary and peppermint oil to try to inhibit that enzyme because it's going to affect how that medication is acting in your body. So we say, inhibit it at your own risk. Here's a study. It says resveratrol suppresses fibroid growth. It's demonstrated to be potential as an antifibrotic therapy for uterine fibroids. Pretty cool, right? And we know resveratrol slows down CYP3A4. So resveratrol can decrease that proliferative estrogen metabolite, the 16-OHE1. Pretty cool, right? Okay, so what's another way we can help lower 16-OHE1? Well, we can help clear it out in phase 2, right? We could just get rid of it from the body. So we need to support sulfation and glucuronidation. And a lot of practitioners will support glucuronidation with sulforaphane and calcium D-glucarate. And they'll support sulfation with some sort of sulfur donor. Remember, in order to sulfate, you need sulfur. So NAC can provide a sulfur group, MSM, glutathione, sulfurous vegetables. So just think about onions and garlic, asparagus. Sulforaphane can provide sulfur. And you also need molybdenum to support sulfation. So molybdenum is a cofactor and it helps get sulfur into the cells so that the cells can utilize it. And I have talked to a few practitioners who have actually told me that the molybdenum helped their patients tolerate sulfurous vegetables better. So I always think about like my SIBO patients, and maybe with SIBO, molybdenum might be helpful. Okay, so sulforaphane, it's highest in broccoli sprouts. And I wrote here other great sources are mustard seed and cauliflower sprouts, but they're really not, I mean, I just learned yesterday, they're actually not the best sources. So stick to broccoli sprouts. Okay, so let's talk about her methylation. So remember the 2-OH, the 4-OH, they get methylated in phase 2. And remember her 4-OH percentage is a little high. I mean, if you look at her actual 4-OH dial, it's within range, but she is possibly pushing down this pathway a little too much. So one way we can support the clearance of 4-OH is by supporting methylation. And her androgens, on the top left corner here of page 3 of the Dutch Complete, we can see 4 androgen metabolites. So we have testosterone, which a lot of us are familiar with. And remember, this is more like bioavailable testosterone. It's not total testosterone. And then we've got some DHEA metabolites. So DHEAS, the sulfated form, it's kind of like the storage form in a way. And then these downstream DHEA metabolites, etiocalanolone and androsterone. And we've got these age-dependent ranges here. I kind of blew up the ranges so we can see them better. But you'll see if you compare it to the age, to the ranges here for people's age, that for her age, her testosterone looks great, but her DHEA metabolites are a little on the low side. And below here, we have this dial. It's the 5-alpha reductase activity. And remember, androgens can be metabolized either by 5-alpha reductase or 5-beta reductase. And 5-alpha reductase tends to turn androgens into potent androgens, whereas 5-beta reductase will turn androgens into these less potent ones. So if you metabolize your androgens down the 5-alpha reductase, the 5-alpha pathway, they're going to turn them into these more potent androgens. It's going to make the body feel like there's more androgens around. Well, for her, she's pretty balanced between the two. She might have like the slightest little preference for the beta pathway. So even though her androgens here are kind of normal low overall, she's also kind of pushing them a little more down that's less potent pathway. So the body kind of might feel like there's a little less androgen activity. On page 2, I love to point this out. On page 2, there's a few markers that are not on page 5 or page 3. So always go back to page 2 and check these out. Because the 5-alpha DHT, for example, this is the active form of testosterone. And so it's a really important one to look at because it's 3 times more potent than testosterone. The 5-alpha DHT is actually the metabolite that hangs out in the tissues and causes like acne in the jaw or hair loss. So check that out. Also, the research shows that 5-alpha androstenediol, this guy here, this is a downstream metabolite of DHT. And the research shows that the 5-alpha androstenediol might actually be a better marker of DHT activity in the tissues than this DHT marker in the urine or the serum. So always check out the 5-alpha androstenediol too. That can give you an idea of androgen activity in the tissues, right? Let's look at her adrenal panel. Okay, here are her adrenals. Let's explain it. So the total DHEA production, here we're just adding up those 3 markers that we saw on page 3, the DHEAS, the etiocalanolone, and the androsterone. So she came out at 1,159, and for her age, we want it between 1,300 and 3,000. So she's below range. Her DHEA is low. And her metabolized cortisol is low. So these are all the cortisol metabolites that we measured in the urine. Remember, the cortisol metabolites are inactive. They're like waste products. You know, when the body's done using cortisol, it metabolizes it and then eventually finds its way out into the urine. So her metabolized cortisol is on the low side, kind of normal low. And the metabolized cortisol can give you an idea of total cortisol production or total adrenal output. And a lot of times, not always, but a lot of times I see total DHEA and metabolized cortisol, you know, both on the low side or both on the high side. And that's because both cortisol and DHEA respond to the ACH signaling that's coming from the brain. So when the brain wants the adrenals to make more cortisol, it'll increase ACTH. And the ACTH will go to the adrenals and say, hey, adrenals, make more cortisol. But at the same time, it says, hey, adrenals, make more DHEA. So I suspect her ACTH signal is a little low. All right, if we look down here, we can see her free cortisone. This is the inactive cortisol, and the free cortisol. This is the active cortisol on the right here. And her cortisone's a little on the low side. Her cortisol looks pretty good though. She's got a nice diurnal pattern here. Her afternoon's getting a little low though. But overall, if you kind of look at all these dials, we're seeing kind of like a normal low picture, right? So good news, she has a diurnal curve. Bad news, her cortisol's a little on the low side. So she's got what we call a hypometabolic pattern. So see how her metabolized cortisol is on the low side? It's pointing, like this dial is pointing lower relative to her 24-hour free cortisol. So this means that cortisol is staying in circulation. It's not being metabolized. It's not being cleared out efficiently. If it was being metabolized efficiently and cleared out efficiently, these 2 dials would be pointing in the same direction within range, right? So this just tells us that it's not being cleared out efficiently. And you tend to see that in things that slow down metabolism rate, right? So you tend to see it with hypothyroidism, low calorie intake for the amount you're exercising, suboptimal liver function, suboptimal mitochondrial function. Remember, the mitochondria make ATP. They're really important for our metabolism. So all of these, we can see sluggish metabolism, sluggish clearance. So we might want to look into these because a really cool thing to know is, pro tip here, improving cortisol metabolism and clearance can lead to improvements in DHEA production from the adrenals. Okay, so I want you to try to imagine this. Let's just pretend she had hypothyroidism and you corrected that, and all of a sudden she could clear out her cortisol efficiently. So what would happen is the metabolites would go up, right? Because she's clearing out her cortisol more efficiently. She's metabolizing it more efficiently. And the cortisol in circulation would go down because she's clearing it out more efficiently. So the brain senses cortisol in circulation. And the brain would be like, oh, wow, the free cortisol is going down. I need to replace it. So the brain would increase the ACTH signal to the adrenal glands. Say, hey, adrenals, can you make some more cortisol to replace the cortisol that's been cleared out? So the ACTH signal would rebalance. It would go up. Cortisol production would go up, and DHEA production goes up too, as a nice little kind of side effect. Okay, let's look at her OATS panel. And remember, our Dutch tests now, as of this month, have 3 new markers. So this is an older test. It doesn't have those 3 markers. We have a marker for gut function or gut health, dysbiosis. We've got a marker for biotin, and then we've got a marker for neuroinflammation. So those are pretty cool. Okay, so here her B12 marker is on the high end of range, and this 1B6 marker is on the high end of range. Remember, if these are high, it means there could be a deficiency. So she might be a little low in B12, B6 is possible. And her adrenaline metabolite's a little low. Sometimes I see this with lower adrenal output because the adrenals make a lot of adrenaline. Okay, summary of findings. So her progesterone was within range. Her estrogen, her DHEA, and her cortisol were all kind of normal low. She's got this preference for 16-OHE1. Her 4-OH percentage is a little tad high. Low activity down the protective pathway, right? She's not really pushing down the 2-OH pathway in phase 1. Sluggish methylation, hypometabolic adrenal pattern, right? Sluggish clearance of cortisol, and maybe some low end B12 and possibly B6. All right, so what are we gonna do about it? Well, we should probably do some additional labs, right? I'm gonna do a CBC, a CMP. I just always, basic labs, always do those. The full thyroid panel, remember hypothyroidism can lead to sluggish clearance of cortisol, which can indirectly lower DHEA and estrogen. So I'm going to look at her thyroid. And you might ask, okay, how does that affect estrogen levels? Well, hypothyroidism in the research has been shown to just lower sex hormones. You usually see lower sex hormones with hypothyroidism, not always, but usually. So if you think about it, I just saw this in a research study. In the tissues, like 50 to 60% of estrogen in the tissues comes from DHEA. So if your DHEA is low, your estrogen in the tissues is probably going to be lower. Plus, just in general, DHEA aromatizes to estrogen. So if you have less DHEA, you have less estrogen. Also, DHEA, super important for fertility, super important for follicle development. So if you've got a healthier DHEA, you'll probably have a healthier follicle, and healthier follicles make healthier amounts of estrogen. Remember, when you have that follicle and it's growing with the egg, it's making estrogen. And it's that estrogen that surges that causes LH to surge, which causes the egg to ovulate. All right, we're definitely going to try and look up her vitamin D, because we know low vitamin D is a risk factor for fibroids. And I want to look at her iron, just do an iron panel, because she's been having some heavy bleeding. Heavy bleeding over time can lead to anemia, which can lead to all sorts of issues, including fatigue. Okay, so here's a sample treatment plan. And just a reminder, Laura, she's in her late 20s. She's got the heavy bleeding, the tender breasts, and the uterine fibroids. Okay, so first thing first, we're going to try to lower the 16-OHE1, because remember, that's the proliferative estrogen. And it can bind to estrogen receptors in the fibroids and possibly cause proliferation. So we're going to try some resveratrol. This is a product from Apex Energetic. It's got 250 milligrams of trans resveratrol extract per teaspoon. So it's pretty potent. And the resveratrol, it's going to inhibit the CYP3A4, right? So it's going to decrease the 16-OHE1. It's going to inhibit the CYP1B1, and CYP1B1 turns estrogens into 4-OH. So hopefully it'll actually lower the 4-OH percentage too. It induces quinone reductase, which can help reduce estrogens, semiquinones back into catechol estrogens. So remember, the 4-OH can become a quinone and cause DNA damage, right? But quinone reductase can come around and take that quinone and reduce it, kind of push it back to 4-OH. And it induces this NRF2. This is like a genetic antioxidant pathway, basically. It's an antioxidant pathway. Okay, rosemary. We're going to cook with more rosemary. There's some recipes out there that have rosemary in a tea. You can drink a rosemary tea every morning. And the rosemary, remember, I feel like it's a dietary approach. It's a gentle way to inhibit the CYP3A4 to decrease that 16-OH. It actually upregulates CYP1B1. And CYP1B1 is the enzyme that pushes the estrogens down the protective pathway towards the 2-OH. So that's good. Away from 16 towards 2. And rosemary, we know it supports brain function and it can support the cortisol awakening response. So maybe it'll support her cortisol too and her adrenals. All right, so other ways we can reduce the 16-OHE1 are proliferative estrogen. Cruciferous vegetables and the Apiaceae or the carrot family vegetables, eat them daily to support clearance of estrogens down that protective pathway. So these vegetables are so awesome. You want to probably get some cooked, some of them raw on a daily basis. It's going to help really metabolize those estrogens down the healthy pathway, the protective pathway. It'll help lower the 16-OHE1. And remember, what was it? Green vegetables, lower risk for fibroids. So there you go. What about DIM? So I have a lot of people say, well, what about DIM? Like, why don't you use DIM with her? So I say, DIM can do a great job. It does a great job at pushing estrogens down the protective pathway, that CYP1A1 pathway towards the 2-OH. However, it also lowers circulating estrogens. So if you've got high estrogens and you want to push the protective pathway, then great. But also, if methylation is slow and you take DIM, it can cause the 2-OH estrogen catechol to build up in phase 1. And remember, any phase 1 metabolite can cause oxidative damage. Even the 2-OH metabolites can cause oxidative damage and DNA damage. They just don't cause as much damage as the 4-OH. But yeah, if you use DIM, like whenever I use DIM, I just make sure methylation is working well, because you don't want to take estrogens out of circulation, push them into phase 1, and then have them just build up in phase 1 because they can't be methylated. They can't be moved over to phase 2. I think that's why women tend to have, if they're going to have a reaction to a supplement, it's often DIM. Okay, so let's reduce 16-OHE1 by helping to clear out estrogen. Let's support sulfation. Let's support glucuronidation. So in order to support the body in clearing out the 16-OH metabolites through the bile, the urine, and to support the clearance of the endocrine disrupting chemicals. So remember, endocrine disrupting chemicals, some of them, like the polycyclic aromatic hydrocarbons, upregulate CYP3A4 and can increase 16-OH. And then others, like the PCBs, the phthalates, the bisphenols, can increase risk for fibroids. So if we're supporting glucuronidation, supporting sulfation, even methylation, we're just going to be helping the body to clear all those endocrine disrupting chemicals out of the body. Broccoli sprouts. So I want to talk about broccoli sprouts. One way you can support sulfation and glucuronidation is through sulforaphane. And broccoli sprouts has the highest amount of sulforaphane. And I'll talk about the Hamama subscription on the next slide. But broccoli sprouts are the best source. Yeah, cross out mustard seed and cauliflower sprouts. Just focus on the broccoli, honestly. Sulforaphane supports sulfation and glucuronidation, like I said before. And it helps to activate these antioxidant pathways. It prevents DNA damage from the phase 1 estrogen catechols because it upregulates antioxidant pathways, which are going to protect the DNA. But sulforaphane also increases the amount of phase 2 enzymes. And remember, in phase 2, we're methylating, we're sulfating, we're glucuronidating. So sulforaphane will improve those. Note that sulforaphane degrades in our stomach acid. So glucoraphanin, best coupled with the myrosinase to activate it. It might be better to supplement than sulforaphane itself, or you could just eat broccoli sprouts. But this does bring up a really good point. It's actually the glucoraphanin which reacts with myrosinase to make sulforaphane. So if you get a supplement, you want to get one that has glucoraphanin in it and myrosinase. It doesn't have to have myrosinase. Actually, our gut bacteria can make myrosinase. So we have a lot of myrosinase in our gut, which can help convert that glucoraphanin or glucoraphanin into sulforaphane. But the amount of myrosinase that each of us has in our gut varies, right? Because our microbiome varies. We are going to have different amounts of that, those bacterium that make the myrosinase. Okay, so with broccoli sprouts, you can go through like a seed subscription service like Hamama. They do organic broccoli seeds. They have a bunch of other seeds too that you can sprout. But this is like a really easy way to do it. You can also sprout your seeds on your own with like a mason jar or a ball jar. If you look up Dr. Rhonda Patrick, I think her website is foundmyfitness.com. She has a lot of information on sprouting. I want to say she's been talking with Dr. Jed Fayer. I'm forgetting his name, but he's a world expert on sulforaphane. Very knowledgeable, very nice guy. All right, so another way to reduce this 16-OHE1 is we're going to avoid those things that increase the CYP3A4 activity, like St. John's wort, caffeine, smoking, obesity, alcohol consumption, all the things that we were talking about here. So if you want to reduce your exposure to polycyclic aromatic hydrocarbons, some of them like are things you probably want to do, like limit inhalation of gasoline fumes. Don't hang out in the gasoline. Oh my gosh, what do you call that? The gas station. There we go. Don't hang out at the gas station too long. Limit inhalation of smoke from wood fires. That's a big one. But some of the things you probably don't, maybe you don't want to limit. It's like, oh, I have to limit my grilled foods and my smoked food. I love smoked salmon. My fried foods, I love tempeh. Not tempeh. What am I thinking of right now? I'm kind of blanking on that. But yeah, I mean, you don't have to eliminate them completely, but maybe just limit inhalation of fumes from oil heated at high temperatures. Consider an indoor air purifier. So I actually have an Air Doctor air purifier, which I love, and I recommend it. But when we cook, that air purifier it clicks on and it goes up to full speed because it can just detect the fumes in the air. So really interesting. It really does help clean up the air after you cook. You could also just get like a Blackstone, put it outside, and do a lot of your cooking outside so it's not indoors. Okay, so reduce exposure to pesticides. Remember, pesticides upregulate CYP3A4, which can increase that 16-OH, that proliferative estrogen that might increase the fibroid growth. This is EWG's 2022 Dirty Dozen list. The Dirty Dozen list is kind of like the top 12 fruits and vegetables that have the most amount of pesticides in them. So they're the ones that you really want to buy organic if you're able to spend the money on organic produce. If you're not able to spend money on organic produce, it's probably better anyways to just eat conventional fruits and vegetables instead of not eating any at all. But did you know, this is a really fun fact, not fun actually, it kind of sucks. I just learned this, the Dirty Dozen and the Clean 15, the lists are based on the USDA's pesticide analysis, which are not comprehensive. The USDA does not test for glyphosate. I want to say it again. The USDA does not test for glyphosate right now. That's Roundup. That's Monsanto Roundup. And they rotate the fruits and veggies it tests every year. So when I read that, I was like, oh gosh, do I have to buy everything organic now? All right, so here's the Clean 15. These are the ones that they say, you're probably okay if you don't buy these organic. I was really happy to see avocados on here. I eat like one a day. They're so delicious. Okay, so I also want to support methylation and sulfation. Remember, this is just going to help clear out the estrogens and clear out the 16-OH with that sulfation. So this is a Seeking Health Multivitamin 1. It's a multivitamin. I really like it though because it's got a robust amount of B vitamins here. It doesn't have a lot of B12, so I'm going to actually add that in separately. but it's got a little bit of vitamin D, which might help prevent more fibroids. When I get her vitamin D results back, if she's low in vitamin D, then I'm going to have to add on more vitamin D on the side because this just has 1,000 IUs. It's probably not going to cut it. What else? It's got molybdenum, which remember that's the cofactor for sulfation. So it's got some molybdenum in there. It has choline, and we know choline supports methylation. What else supports methylation? B vitamins, B12, folate, B6, choline. Choline converts to trimethylglycine. Another name for trimethylglycine is betaine. So choline converts to betaine. Betaine supports the methionine cycle, so it supports methylation. And then iodine. It's got 100 micrograms of iodine, which we know iodine supports breast tissue. It can help with fibrocystic breasts, which Laura has, and hopefully it'll help prevent more fibroid growth because here's another study. Iodine may help reduce fibroids. Very cool. A lot of times I'll go even higher than 100 micrograms. I might go to 500 micrograms. Some people go even higher. I think there's what's that company called? Violet Daily. Violet Daily has 3 milligrams of molecular iodine, and they use it for breast tenderness. Okay, so I'm going to add on that B12 on the side. I like to do the liquid form. I like to do sublingual B12 anyways because it kind of bypasses the stomach acid issue. A lot of people, especially if they're stressed out, which seems like everyone's stressed out, or when you get older, your stomach acid declines and you need stomach acid to absorb B12. So if you could just take it sublingually, kind of hold it under your tongue for 20 seconds, a lot of it can diffuse into the bloodstream because if you look under your tongue in the mirror, there's a ton of blood vessels. So it can diffuse into the blood. And then we're going to add on some magnesium powder because magnesium supports methylation. It's a cofactor. You need magnesium. Plus magnesium before bed at night. It's just nice. It's calming. It's calming for the nervous system. And I remember one of my teachers back in school said, when you burn magnesium, it burns this like beautiful white light. So when people take magnesium, imagine that beautiful white light being emitted in their body. And, it's known that magnesium helps with depression. So it's kind of increasing that bright white light within you. All right, so we want to reduce the risk factors for fibroids. And remember the PCBs, the phthalates, the bisphenols, those can increase risk for fibroids, the red meat consumption, inadequate vitamin D levels. So these increase risk for fibroids, and some chemicals like the bisphenol A, BPA, can act like estrogen in the body. Gross, right? So we get these xenoestrogens acting like estrogen in our body. Okay, let's do a little deeper dive into the PCBs, the phthalates, and the bisphenol. So PCBs, think of PCBs as kind of like a waxy substance that just sticks around forever. Like we just can't get rid of it. The half-life is years. It might be months or years. It's just a long time. There's a lot of it still around. It was banned in 1970s. I think it was around since the 20s. So about 50 years we were manufacturing this stuff. And now it's in our landfills, it's in our hazardous waste sites, and it leaches into our water. So another reason to purify your water. It degrades really slowly, so it just sticks around. And it's lipophilic. It's waxy, right? It likes fatty tissue. So it builds up in the fat and it builds up in your fat. Your body stores it in the fat and can take a long time for your body to get rid of it. Sometimes it doesn't get rid of it. So it's found in the air, the soil, the water. Phthalates. Oh my gosh, phthalates are in hundreds of products. Okay, it's in shampoos, hairspray, soaps, deodorants, nail polish, lotions, plastic packaging, garden hoses, medical tubing, vinyl flooring, lubricating oils, carpets, adhesives, even in like shower curtains. It's added to plastics to make them more pliable. And phthalates are higher in Black women and Hispanic women. Interesting, right? They're often found in fragrance. So if you see something that says fragrance in it, that's not from essential oils, I kind of like stay away from those products. Bisphenols. Bisphenols, or like BPA, for example, or BPS, it's found in water bottles, juice bottles, food containers, eyeglass lenses, the lining of food and soda cans. Sometimes when you buy cans, especially if they're organic, like organic refried beans, for example, sometimes on the label it'll say like can lining is BPA free, which is great. But a lot of times when these water bottles they say, oh, BPA free, they actually have BPS in them instead now, which is like not really any better than BPA. It might be, but not that I know of. I know it's still not a great chemical. Oh, and I learned that BPA is in toilet paper. Fun fact. Okay, so if we want to reduce our exposure to these chemicals, we're going to try to eat unpackaged, unprocessed whole foods as much as possible. Try to fill your basket with these whole foods. Use fresh and frozen fruits and vegetables. Apparently, the plastic bags used for frozen produce don't contain the phthalates and the bisphenols. Plus, I mean, it's frozen. You really have issues when you start heating up plastic. So it's not great, but it's frozen. It's better. Limit the fast food, the processed meals. Mac and cheese in a box, spaghetti in a can. Those are going to have more of these chemicals. Buy soup, sauces, and beverages in glass. So try to stick to glass whenever you can, because cans tend to have bisphenols. Especially avoid plastics with the recycle numbers 3, 6, and 8, because these have the phthalates and the bisphenol. And avoid plastic wrap. Consider beeswax wraps instead. Those actually, they work. They work. I mean, not for everything. I have both. I keep both around. Swap out your vinyl shower curtain for a fabric one. This is pretty easy to do. Avoid heating up plastics. Don't microwave your food in plastic. Avoid touching store receipts. Store receipts have BPA. And if you work somewhere where you're handling receipts all the time, wear gloves. Just don't touch that stuff. Avoid products with fragrance. Remember, fragrance can have these chemicals in it. Remember, unscented products can still contain fragrance chemicals to hide other smells. So clean up dust in your home. Try to dust when you can. I should take my own advice, but phthalates can accumulate in the dust in your home. So my baby just like an hour ago was, she's standing up now and she's touching everything, the counter or the TV over there, and she's just like touching all the dust, and all I can think about is, oh, phthalates, phthalates. That's where my mind goes. Use a vacuum with a HEPA filter. The HEPA filter is really going to keep that dust from spewing out the other side of the vacuum. And replace the skincare, the hair care, the household cleaners, all your lotions and potions with EWG, Environmental Working Group certified products. So this is the website you can go to. Sometimes instead of just trying to look up all the ingredients in the products you're using already, it's just easier to just switch over to an EWG certified product. When they're EWG certified, they're safe. They don't have these chemicals. And then, so we're going to do a referral to gynecology to monitor the fibroid size. So here's a summary of the treatment plan. We've got the resveratrol, the multivitamin, the B12, magnesium. We're going to increase this consumption of the cruciferous veggies, the rosemary, the carrot family, broccoli sprouts. And we think that having a couple ounces of broccoli sprouts every couple days should be sufficient. And for reference, those broccoli sprouts you can get in the store, they're like this big container. I think that's about 4 ounces. So limit or avoid things that speed up the CYP3A4. Let's limit our alcohol, our caffeine, pesticide exposure, those polycyclic aromatic hydrocarbons, and the charred foods, the grilled foods, the smoked foods. And then limit things that increase risk for fibroids. I mean, why not? These chemicals here, the red meat and low vitamin D status, and referral to gynecology. So this is kind of what the treatment plan is aiming to do. I always like to put this at the end so you can read it and you can really understand, like, why did we choose the things we did in this example treatment plan? How is this going to help the fibroids? How is it going to help the heavy bleeding and the breast tenderness? So number one, our goal is to lower that proliferative estrogen metabolite, the 16-OHE1. It's going to help slow the fibroid growth, reduce the breast tenderness, and the heavy bleeding. Because you see all three of those when 16-OH is high. We want to support healthy estrogen metabolism and healthy estrogen clearance. So we're going to support phase 1 with all of these things. And when you support estrogen metabolism and clearance, you may help slow fibroid growth and reduce breast tenderness and heavy bleeding because these are all estrogen dependent. Oops, we're not done here. Okay, lower the risk factor for fibroids. So we're going to avoid those chemicals, going to get the vitamin D levels up, limit the red meat consumption, and support liver function. So when you support liver, remember, when you support the liver, it can support the clearance of cortisol. And when you support the clearance of cortisol, it can support DHEA levels. When you do liver support too, it can help detox those endocrine disrupting chemicals, some of which are those risk factors for fibroids, and others like the polycyclic aromatic hydrocarbons that upregulate CYP3A4. And you might be asking, how are we supporting liver function with this protocol? Well, the B vitamins, the magnesium, all of these veggies here have constituents that help support liver function. Those are all going to support the liver. Plus, when you kind of like clean up the crap, take out the PCBs, try to limit the polycyclic aromatic hydrocarbons, the bisphenols, cut out all that, the chemicals, it's going to reduce the load on the liver. So it's going to not have to focus on detoxing all these chemicals that we're putting on our skin and our lotion every day. And we want to monitor fibroid size over time. So that's it. That's the case study. I really hope you learned something new. I hope you enjoyed it. If you have any questions at all, just email info@dutchtest.com. You can also find me on Instagram, but honestly, I don't check it that often. I'm trying to stay away from social media these days. Give my eyes a rest, right? All this screen time. So yeah, hope you enjoyed it and give us, shoot us an email if you have any questions. All right, bye-bye.